So the 1918 pandemic was a novel strain of influenza, and it circulated over a number of years. And in fact, once the pandemic, there were several waves of that pandemic impacting the globe. And that virus itself, once the really intense transmission was over after those waves, that virus circulated for many years, for decades, until another strain replaced it, circulating globally. So I think there are similarities. I mean, these are respiratory pathogens. There are numbers of interventions that are put in place for the 1918 pandemic, many of which are being implemented now during the SARS-CoV-2 pandemic. And I think one of the things that you reminded me of in your first part of your question about your driver's license and the impact that this has had, pandemics have incredible impacts. They are pandemics. You know, they are affecting every aspect of our lives right now. And so what we are trying to do in our control program around SARS-CoV-2 is about how do we save lives, but not only focusing on health aspects, but how do we save livelihoods, and how can we help save economies and bring economies back up. And right now, we're still very early on in this pandemic. And I know many people are tired and many people have fatigue as it relates to this. We do as well, but we have quite a long way to go. So we need to remain focused, we need to remain ready, and we need to apply pressure to the virus. We need to apply pressure to try to prevent as many infections as we can and save as many lives as we can, not only from COVID-19, but from all of the other diseases that are circulating that plague many populations, to make sure that essential medical services continue and other services continue so that people can go on and live their lives.
Thank you, Dr. Van Kerkhove.
Margaret, this is Mike.
Yes, I was going to say, I knew you had something to add. Please go ahead.
No, I think maybe Dr. Tedros might want to add, because he's been saying for so long that we will get through this together. And human populations, we've been through collectively so many different epidemics, wars, conflicts, political crises, and human beings are resilient. We are a resilient species, and we will get through this. And yes, the disruptions are terrible. They're awful, but they will end, and there will be a brighter day. And some countries are creating that reality right now in the way they're approaching this response. What we do need to do is get real. We need to be very, very serious and dedicated in our efforts to suppress this disease, reduce mortality, and learn to find a way to control and suppress this virus, learning to live with it in effect, and then hopefully bring online vaccines that will ultimately help us to bring it under control. But with regard to the 1918 flu pandemic, it was as Maria said, in three waves, and it took about 15, 16 months for those three waves to pass. In fact, in the US, the second wave, which started in the fall of 1918, was actually the wave that caused the most damage in terms of deaths. And then the third wave occurred in the winter spring of 1919, sorry. And so it took three waves for the disease to infect most of the susceptible individuals and then settle down probably into a seasonal pattern. For example, the seasonal flu we have now contains the pandemic flu virus from 2009. So very often the pandemic virus settles into a seasonal pattern over time. So yes, but this virus is not displaying similar wave-like pattern. Clearly, when the disease is not under control, it jumps straight back up. But from that perspective, the classic wave pattern of the 1918-1919 pandemic was very clear. But it did take three complete waves for that disease to spread around the world and infect most susceptibles. The second wave was actually the most impactful in terms of deaths and hospitalizations, particularly in the US.
Thank you very much, Dr. Ryan. I was just looking.
I think it has been said, but the waves that have been described actually, they took 2 years I think from February 1918 to April 2020, 2 years. So it took 2 years to stop, to end. And in our situation now with more technology and of course with more connectedness, the virus has better chance of spreading. It can move fast because we are more connected now. But at the same time, we have also the technology to stop it and the knowledge to stop it. So we have a disadvantage of globalization, closeness, connectedness, but an advantage of better technology. So we hope to finish this pandemic before less than 2 years, especially if we can pull our efforts together and with national unity, global solidarity. That's really key, with utilizing the available tools to the maximum and hoping that we can have additional tools like vaccine. I think we can finish it in a shorter time than the 1918 flu.